Going to talk to you about the carpal tunnel injection. To perform this injection, the patient will be lying either supine or sitting with the arm on the arm board. We'll be using high frequency linear ultrasound probe. You can use a hockey stick probe if that's available. To perform this procedure, we will be putting the ultrasound probe on the distal palmar crease. Now in this structure, many of them look like nerve, but the easiest way to find the nerve is asking the patient to move the flexor pollicis longus tendon. The nerve is usually lying medially to the flexor pollicis longus. As you could see, our model is moving the flexor pollicis longus tendon, and this is the ulnar side or the medial side. You have an ulnar artery along with the ulnar nerve. I'm moving laterally now. You can see the flexor pollicis longus tendon, and the nerve is usually on the ulnar side. Now, how do we know that's a nerve? The way to do this is to chase. Now we can see the nerve is going to move from ulnar side to the radial side, and it's now in the forearm between the superficial and deep flexors. So you have a radial artery pulsations there going to move down, and you will be able to see the nerve coming back into the carpal tunnel. Now, as I said, it's a tunnel. You need to look at the white, black, white shadow on the top, which is the flexor retinaculum, and you need to do the injection below the retinaculum. To do the injection, I always prefer to go from ulnar to medial side. Always keep in mind you want to avoid the palmar cutaneous branch of the ulnar nerve. So try and avoid injuring that nerve. Bring the needle in plane. I'm going to freeze the image and I will show you the needle position as well as the structures. So we have here the median nerve, flexor pollicis longus tendon, and you will be bringing the needle in plane, going below the nerve and then going above the nerve, trying to free off the nerve from the flexor retinaculum. The local anesthetic and steroid volume would be about 4 to 5 cc's.